Thank you so much, my viewers and my subscribers. It's my pleasure to have you again on this channel, Students to Potential. Today, I'm having one of the most important student leader with me today to come and share his insight about different things that he as a student is accomplishing or is chasing after. Thank you so much. Welcome, Honorable. Thank you very much. My name is Gatduel Badeng is public health student pursuing bachelor degree at Kampala University. I'm in my second semester. I'm also a nurse by profession, a nurse which is registered by the Uganda Nurses and Midwifery Council licensed. I'm also currently the secretary for health at the South Sudanese Student Union in Uganda. Thank you so much for joining me today on this platform to come and share your insight with the people outside there on the daily health issues that is affecting the communities and affecting people around across the world. Thank you so much. But before, I would like to know from you, what is that essential thing that drove you to pursue public health? Thank you for that question. Actually, my dreams of becoming public health officer or public health practitioner began some time back. I think probably if I'm to say that is more than 10 years from now. Okay, to cut it short, when I was having this dream, in the beginning I want to be an engineer. Engineer mostly the electrician, the electric part of it. Yeah. So it happened during the time of the South Sudan Civil War. I happened to see some scenario in the hospital where most people were dying unattended. There was insufficient lack of human resource from the hospital where there are no doctors, there are no nurses. Then from there, I changed my mind because of the humanity that I want to serve my country. And then I dream of becoming a medical doctor. But because of the resources, there was no way that I could make it to be a medical doctor. And then I started with nursing at the Uganda University. That was in 2019. When I finished it in 2022, I graduated in 2023. And the reason being to change to public health also was nursing was, I found myself that nursing was mostly in the hospital where I was handling only the medical part of it. So I was limited. There was no way of spreading out to the general public of the South Sudan. So I have to change my mind to join public health. So that's why I joined public health. Only that to have the advocacy, the leadership to the South Sudanese, taking the medical leadership, the policy to South Sudanese and spread to them. Wow. That is something which is so passionate that is driving you to become a public health practitioner. I am really so impressed with that. Of recent, I encountered different outbreaks in South Sudan about different types of diseases, viruses, since some decades back. I would like to know from you as a public health practitioner, what is your insight about the disease which is known as hepatitis? What can you tell the general public about that disease? Actually, hepatitis is mostly, in a simple term, is defined as the inflammation of the liver. That means the liver is either inflamed or enlarged. Yeah, or it can also be totally destroyed. Yeah, so that is hepatitis. Recently, we have most outbreak in South Sudan for hepatitis, and mostly the hepatitis E, which is, if I'm to say the hepatitis A and E, we had nice outbreak in South Sudan. And there was some certain place where I come from, that was Kanga County. That Kanga County was had an outbreak of hepatitis E. Yeah. So if I'm to break it short, hepatitis has 5 different types. That is hepatitis A, B, C, and D. Yeah. So the hepatitis, it is also grouped into majorly 2. or three. That is A going together with E, and B going together with C, and also B going together with D. Why am I saying this? The hepatitis A and E, they are acute, meaning they are mild. They can be treated. Yeah. Although they have a sign and symptoms related to the other hepatitis. Yeah. And the only difference with hepatitis A and E is that the hepatitis A has an option for immunization, while the hepatitis E can cause a liver failure if it infects the pregnant mother. Yeah. And then for hepatitis B and C, those are the chronic ones. Yeah. Meaning you cannot treat them. So but they have the option for immunization. Yeah. So we know that the hepatitis there are like three major way of immunizing. That is, the first one is called zero hepatitis B. That is given during the birth, during delivery. Yeah, and then the other one is given. The other one is given with diphtheria. That is DCT. Yeah, that's called diphtheria and tetanus. They are given together. Yeah, so that is the setting which is mainly in East African country and also in Uganda here. Yeah. So the hepatitis E, the hepatitis B, you cannot have hepatitis B when you don't have hepatitis B. So meaning you have to get hepatitis B and also you get hepatitis B. Yeah. So if I'm also to bring into the sign and symptom of hepatitis, yeah, we know that majorly people know only like 2 to 3 signs and symptoms. That is the jaundice, which is the yellowish of the eye. And then the other thing is we also person can get fever, the person can get nausea, person can get malaise, yeah. And then also because with the progressive when it is developing, a person can also get ascites. That is the fluid being contained in the stomach, in the abdomen. Yeah, so you find someone is developing the stomach. So yeah, so that means the liver is already failed. Yeah, and the function, we know the function of the liver. The liver is mainly is to break down, is for storage, filtering the blood, and also to break down the red blood cells. Yeah, so liver is one of the very vital organ in our body. So we cannot take it for granted. We have to prevent it from being infected. Yeah. So the treatment which are out there are some diagnoses in the medical lab. Yes, there are very much of it, and the only treatment which are there if it is developed into chronic, then we can either do transplantation of the liver, which is very costly, and I don't think we can afford it. It is very expensive. Yeah, but most developed countries they can afford that, and also it's being done majorly outside. And the other treatment for the chronic is antiviral medication. Yeah. And then for the acute, if it is A or E, you can either have some rest at home, and then also you hydrate, you take sleep. Yeah. So the hepatitis, the transmission of those hepatitis either being chronic or the acute. We know hepatitis A and hepatitis E, they're being transmitted through fecal oral route. Fecal oral route, what I think means it means that they can be transmitted through the mouth. Yeah, so that's what it means by fecal oral route. Yeah, and then it can either be in form of food or form of water. Yeah, so that's why we encourage every citizen to at least practice good proper cooking of meat or the item and boil water. Don't drink dirty water. Yeah, because the majorly South Sudan the water in South Sudan is very poor. That's why these hepatitis A and E they were so much outbreak in the country. Yeah, and for hepatitis B and C, you can transmit them. The transmission is through the blood. That means if you contact a certain object, such object which is infected with the hepatitis virus, yeah. Also, during the blood transfusion, you can even through sex, you can contact, and the transmission can happen through that way. Yeah. So thank you.
Wow. Okay, now with this brief explanation you have given us, it has given you as a person an insight of the danger and then the causes of it. As personnel, I would really love for you to share for the public on the preventive measures of what you're supposed to do as people who are from a rural area. What are they supposed to do? In order for them not to contact that virus or for it to spread, especially from the way you are saying sexual, it is also sexual transmitted disease. So, what are the things that people are supposed to do? Thank you.
Thank you for that question. The only advice I'm going to give to all the listeners and the general public out there is to take care of their health. Why? Hepatitis is something that can be prevented. You can either prevent it yourself or you can prevent it through reaching to the hospital. Let us be cautious of our health, starting with the mothers. Let them attend the antenatal. They get the vaccine, the injection which is supposed to be given during the pregnancy. And to their child during that, let them give that at any health facility so that their babies will be taken care of. They will be given the zero hepatitis B vaccine during delivery. And when someone is suspecting or even before suspecting, make sure you also know your status. Hepatitis is having like 3 doses of vaccine. Yeah, so at least I advise everyone to get that we are all safe. Another thing is the other hepatitis which are mostly spreading out in South Sudan. People just need to take care of themselves like the hygiene, which is mostly the water. Let them make sure you drink safe water, safe clean water. Yeah. I know it is hard, but there are so many ways you can do that. Even boiling. You can boil the water if you don't have any borehole or running national water. Yeah. So you can do that. Another thing is also cooking the food because you know the virus could come in so many ways. Yeah. So you have to cook your food properly, especially the meat. Yeah. So those are the most important thing I want to emphasize.
Okay. Thank you so much, our viewers and our subscribers. It is clear to us that this disease is something which is serious and it is affecting people outside there. We need to be cautious about such things, and we need to be always vigilant in order to reach out to nearest any health center. Thank you so much, Lou, for joining us on this platform, Honorable, for sharing your insight to the people of community, to the people of South Sudan, and to people across the world to take their health as the first priority and to believe that their health is very important. Thank you so much for joining us today, and thank you for sharing your insight. Thank you so much.
Thank you so much for asking, and may God bless.
Thank you for following up on our content today. It is really a pleasure for you to be a subscriber and for you to be our viewer on our today's discussion with one of the most important guests we hosted today on this platform. I will request you to hit the subscription button and to be always alerted about our contents that we will be creating, for you to come and share your insight with us to the community, for you to make an impact to the community on some essential things that you think if you talk about it, if you advocate for it, it will be more of importance and there will be change in our community in different levels. I request you to hit the subscription button and to wait for more of our contents and more of our discussion with the students who are willing to share their potential, who are willing to share their insight about different things to the community. Thank you so much.